This
Okay, thanks.
conference will now be recorded.
Yeah. Go ahead, Karen. Sorry, guys. Yes, we'll do the annual first.
Okay, welcome everybody. We will call meeting to order, the annual meeting, February 11th, 2025. Thanks for coming. Do we have any public comment?
Yes. Oh, I can see these. Okay, last annual meeting minutes was February 13th, 2024. Kristen, Dave, Dr. Hooker, Blair, Gwen, Terry, and Lisa were all present. It was called to order by Vice Chair Dave Sandin at 9:01. Blair read the April 11th, 2023 annual board meeting minutes. Kristen motion to approve meeting minutes as read. Lisa seconds. The motion passed unanimously. There were no term limits to review. Vice Chair Dave opened nominations. Kristen nominated Karen to be chair and Justin Hooker second. The motion unanimously passed. Justin nominated Dave as vice chair and Lisa second. The motion unanimously passed. Kristen nominated Gwen Heaton as secretary and Justin second. The motion unanimously passed. Toole County Health Department will scribe for the secretary position. The next annual meeting will be February 11th, 2025, before the regular meeting. The meeting was adjourned, motion by Dr. Hooker to close the annual meeting. Gwen second. The motion unanimously passed. The meeting adjourned at 9:06.
Okay, do I need approval of the minutes? Second. All in favor, say aye. Okay. Done with that. Terms and the election of officers.
No, this meeting is when we're going to re-elect officers.
So terms and election of officers.
There are no term limits because we did that last meeting, and then just the election of officers. In case anybody wants to see, this is our when people were originally appointed and then their expiration date. So nobody's. Oh, I gotta fix these. These were extended again. Is that right? Mm-hmm. Beautiful. Okay. Anybody want to be?
I will leave the officers as they are.
Second.
Second.
All in favor, say aye.
Aye. Once you're willing to do it, yeah.
No objection yet.
Give them a chance.
4 times a year is not a real stretch.
We try to make it easy.
Yeah. Oh, I guess we have any other business for us?
No, that'll be it for this one.
Okay, you need a motion to adjourn the meeting?
Motion to adjourn. Second.
All in favor, say aye. Okay, well, we've got those business done.
Did I email out the meeting minutes from last meeting to you guys? Don't make me read those. I'll pull them up.
It should be set to everybody though. At least I never got it.
I may have, I just don't remember. It's been a while.
It's been a while,
Yeah. We met in June wasn't the last one.
October, I think, wasn't it?
I can read these, it's not that much. But you can start the meeting, sorry.
Okay, call the meeting to order. Regular board meeting of Toole County Health Department. Since there's no public here, I think there's no public comment. Review and approval of the meeting minutes, Blair, you want to read them?
Yes.
Thank you.
Regular meeting minutes for October 8th, 2024. Board members present: Dave, Blair, Kristen, Lisa, Gwen, Terry, and Ron. No community members present. The meeting was called to order by Vice Chair at 9:04. Dave Sandman, no public comment. Review and approval of the minutes. Blair reviewed the August 6th meeting minutes. Kristen motion to approve the meeting minutes as read. Gwen second. The motion passed. Review and approval of the claims. Kristen motion to approve Dave's travel claim for $29.48 for the August 6th meeting. Gwen second. The motion passed. Our health department report was the contracts have been signed for 2025. We're operating at capacity and spending appropriate funds. This year we're focusing on inspiring personal responsibility, community engagement, out-of-office programs, and maintaining our regular operations. We have been offered training from the state of Montana to discuss community readiness. They will start with our office in DES and then extend to our Board of Health to help better understand what we do in our office. It's a game and it's predicted to last 1 to 2 hours. It's a board game, actually. It's pretty fun. Community diseases are being maintained. There's no active outbreaks. It was immunization season, and so we were busy with out-of-office clinics. We just had a Sunday clinic with several walk-ins for all immunizations. We did not limit it to flu and COVID. We're attempting to we did a radio ad campaign and helped raise awareness of the needs of adult immunizations, and we'll partner with the Caravan to bring back vaccines to the local health park. We will have a virtual tabletop exercise on December 4th from 9 to 11 in our office to assess community support needs for community readiness. We'll offer this to all area partners and hope to get a good show at the event, which we did get a pretty good show. We have several MOUs with the state, counties, and each grant. Currently, I'm not in the office as usual, so these MOUs help cover maintaining those operations. It's imperative that we continue to utilize them and reciprocate when we are able. Sanitarian report was that he completed 100% of his annual license establishment inspection. The Mint Bar of Summers has changed ownership pending approval of the liquor license. I met with Sean Sorensen, a new owner, to discuss the planned operation and define what food items can be sold under the classification of a bar and tavern and what a remodel would look like as a restaurant. He met with Kelly Lord to begin the planning review process for the coffee food shop operated at the Prairie Peddlers' new facility. Discussed with the companions the plan review process necessary to reopen the hotel of the second floor of the Guacamora Bar and Sweetgrass. They decided to wait until spring to begin this process and possibly consider monthly rentals as an alternative to licensure as a hotel. He has received several complaints about the Sagebrush Food Pantry and Lona's in Shelby. He's been unable to confirm the complaints at that time. The investigation continues, and he's been dealing with 5 new and replacement septic systems in various stages of the permitting and approval process. Discussion items were amendment to the bylaws, Article 567, Section 1. After a final reading of the amendment of the bylaws, Kristen motioned to approve the amendment and Kristen, you seconded? The motion carried unanimously. The board meetings will now occur quarterly. Kristen and Dave's end of term was December 31st. Lisa motioned to extend both of their sessions to another term on the board. Terry seconds the motion and unanimously voted to approve the motion. Kristen and Dave's new terms will end on December 30th, 2027. Our PHSI education is on hold due to administrational and organizational changes. We'll try to reschedule that for later. The next meeting will be held February 11th at 9 a.m. at the Health Department Conference Room. Kristen motion to adjourn the meeting at 9:34. Gwen second. Motion passed.
Thank you, Blair. I need a motion to approve the minutes. You want to make that one change?
Yeah. We can make second that.
I'll move to approve the minutes with the amendment. Beautiful.
Okay, minutes have been approved. The claims,
We have one claim for Dave's Travel, and mileage has gone up since January 31st. No, January 1st. So maybe I'll circle back to this and I'll go fix this mileage because it's not accurate. So maybe you can move on to Ron's report and then I'll come back to this.
Ron, you want to give a report?
Okay. We've been starting on the 2025 inspections of the licensed establishments. We're just getting going on those. Been working with 5 either new establishments or change of ownership on plan reviews for new licensure. Started with the Oasis Bar. That's been a couple months ago when they started the remodel. At first they were going to do food, and then when I explained what they needed to do with plan review, they sort of decided that they weren't quite sure what they were going to do. I got a call yesterday from the contractor that they were going to do food, fairly extensive operation, and so it's on hold at this point until I do a full plan review with and wait to hear back from the owner. It's going to be a complicated process for what they plan on doing there. Started visiting with the new leasee for the old Ringside Ribs Clark's restaurant yesterday, and that's moving forward. That's pretty much a state-of-the-art setup there. That kitchen is set up very well. There's a couple minor issues that need to be resolved, but other than that, they can pretty much do anything. They're full menu. Continue to work with Kelly on the Prairie Peddler coffee shop. Been struggling with contractors, still trying to get going on that. I did get word from Sean at the Sunburst Mint Bar that liquor license went through, and it's the ownership has fully transferred. I've approved them for pretty much the menu that Dee Dee was doing, pending visiting with them more extensively if they want to do anything more. And then met briefly with the city on the Shelby Theater. That's going to be a fairly simple. They're required to license because they deal with open food product in the popcorn, but it's pretty about as low risk as you would find. Well, coffee is probably the only thing that's a lower risk. Relicense the tap room under new ownership. Shelby's Elks, probably everybody knows, that license was inactivated as they didn't renew the license. And everyone knows the Derrick Bar was inactivated due to that fire. Licensed late last fall, Logan Hospital Kitchen. We sort of looked at hospitals and nursing homes as more private than public, but the Thomas Cuisine, I think it's a national contractor for kitchens, took that over and they insisted on licensure, so I went through and licensed that inspection. Still have a couple of septic system permits that were granted last fall, waiting spring weather for installation. And finally, it's just generally it's a slow time of the year. Good time to take care of some of these food issues. Get ready for something.
Have you heard what's going to happen with the Derrick? Are they?
He's not planning on doing it. He actually had closed it and moved to Kalispell. He would spend more time over to Kalispell and was trying to sell it. And then it burned down.
Well, partially burned down. It's a real eyesore.
So that's all I got. Any questions?
Impeccable timing. Thank you.
I guess I did have one thing I just thought of because you put it up in the minutes on the food pantry. And I had a pretty extensive, we finally tracked down, had a pretty extensive discussion on what could and couldn't be done. And the next call I got was looking at the Elks and explain what needed to be done to those. Well, hopefully, I haven't heard any more complaints or any more issues yet.
Okay, circling back to claims. So Dave's Travel for this meeting is $30.80. And that's the only,
What's the mileage rate?
70 cents a mile for the first 700 miles. Ellen?
I'll move to approve Dave's travel claim.
Second,
I'll second it.
all in favor, say aye. Aye. Opposed? Okay. You want to do some new ones then?
Yeah, well, we can do it afterwards.
All right. Okay, I think it is everything.
On the downhill slide, we peaked early, we peaked fast, and now we're on the downhill slide, which is kind of across the nation. Peaked hard and fast, and then it was over pretty quick, which is a bonus. So this flu shot season, Jenny helped keep a running total of what we have accomplished. And to be brutally honest, when I first started, we were giving over 700 shots a season, and now we're giving less than 300. So we have seen a massive decline in our office. That's not representative of a massive decline of people getting their flu shots. I think options are just more vast and widely available. But that does, help or not help our bottom line. So we had given a total of 178 total people were seen, 169 total flu shots, 35 COVID shots, 8 RSV vaccines, 2 shingles vaccines, 4 pneumonia, 1 Tdap, and 1 child's vaccine during our flu shot clinics. So they are still, attended. Our numbers are down, but there's still attendance and still desire for those, so we'll keep those going. And then we did an outreach clinic up in Summers, and we got 28 total vaccinations at that day clinic, which was good. Good for us. I think that we'll probably continue to see a decrease, so we'll order accordingly so that we don't have overage. There also has been a lot of public discussion on active tuberculosis in the state of Montana. As of 2025, we do not have any active cases of tuberculosis. We do have several latent cases of tuberculosis, but none active. And most latent tuberculosis patients are pretty compliant in that medication regime and getting that cleared up. So there's no active outbreaks of TB in Montana, because that apparently has been a very hot topic on X, and it's not accurate right now. We are still seeing, though, a huge increase statewide, not so much locally, of syphilis. Our numbers are, 300% increased. We're watching for those, surveilling for those, trying to screen and test for those. There is maybe some options for our office becoming a point-of-care testing for syphilis, and then can refer for treatment. So that's something we might look into, is just being able to test people, because it is so widely prevalent. And in 2019, we noticed men were primarily infected with syphilis, and now in 2024, it is women that are primarily infected, causing fetal demise. So when we kind of anticipate that shift coming, but it does hurt the babies, and that's what we're seeing now. There was several fetal demises compared to years past. And for over a decade, we had 0. So that's a pretty good public health concern. So that's something kind of on our radar, kind of what we're looking at. We have several outreach projects coming up. A lot of summer events are starting to be planned, things of that sort. Any questions? Okay. I can speak on this next one. So part of PHSI grant that we get for a full-time position in our office, they wanted to figure out how boards of health were being operated and ran and kind of a standard protocol of what are we accomplishing with our boards of health meetings. And to be honest, we're accomplishing everything that they asked. The only thing that we hadn't was an annual review of our bylaws. But there's a caveat, right? We were working on those. We were actively working on those. So it was kind of a, yes, we're doing it, but I need to put it on here for future things. So that will stay on here for just a one-time thing at the annual meeting, same time as the annual meeting, so that I know that we complete it once a year, that we review those bylaws and make any changes if we need to. I'm going to assume that they're probably sitting pretty good and we don't really need to make any changes on those, but it was just an annual thing to update on and to go over and things of that sort. So that's what that's on there for. I think we skip it this time. Bring it up next year. And then the PHSI education is still really on back order because of department organizational changes. But there is a Confluence conference, and Confluence is like a public health advocate on a private level that we buy into to support. And they have an annual conference, and it's coming up April 8th, 9th, and 10th in Helena. And they're going to do a lot of sessions on boards of health. If anybody wants to go to that, they're welcome to go to that. The downfall of Confluence is that it's a $350 registration fee, which is quite unfortunate. But we're kind of on the fence about going to that one or not going to that one, so it's not set in stone. But if anybody has interest, we can work on that sort of thing because there is some scholarships for Board of Health members to go. So if you're interested, let me know. Okay, that's all I got.
Great, thank you, Blair.
Yeah.
Does anybody else have anything to bring up? Are you seeing a lot of stuff going on?
Yeah, it's not busy down here.
Right. Yeah, that's it. Anybody else? Blair, anything?
No. Nope. I think we're good.
Okay. I guess I'll need a motion to adjourn the meeting.
Motion.
A second. All in favor, say aye.
Aye.
Thanks for coming, everybody.
Our next meeting will be May 13th at 9 a.m. And I will send out those meeting minutes because I do not want to read that again.
Thank you for that reminder text I had on my calendar for Thursday.